Greetings to all the respected judges and delegates of AIOC2022. Myself, Dr. Alankrita Hazarika, from postgraduate trainee from Assam Medical College and Hospital. The topic of my paper presentation is acute ocular complications in patients undergoing radiotherapy for head and neck cancer. So starting with the introduction, radiotherapy is the treatment of choice in patients with low-grade ocular head and neck cell tumor and other head and neck cancer. It offers an alternative to enucleation for patients with intraocular tumors but may end up with a myriad of other ocular complications as seen in figure 1 and 2. Radiation-induced ocular morbidity encompasses a spectrum from transient eyelid erythema to complete loss of vision. Acute ocular complications presents within 3 months of therapy and occurs either as a direct result of the radiation for intraocular tumors or when the eye is within the entrance or the exit beam. So the aim of my study is to observe the various acute ocular complications in the patients undergoing radiotherapy for head and neck cancer, and my objective is to evaluate the type of complications. My study was a hospital-based prospective study consisting of 85 patients undergoing radiotherapy for head and neck cancer attending the Department of Ophthalmology and Radiation Oncology AIMS Dibrugarh from July 2020 to June 2021. So the inclusion criteria includes all the patients diagnosed with head and neck tumor undergoing radiotherapy and patients of all age group, whereas the exclusion criteria consists of patients receiving simultaneous chemotherapy, cases with known pre-existing ocular disease, patients with systemic disease, autoimmune diseases, and blood dyscrasias. All these patients underwent complete ophthalmic examination including detailed history, base-corrected visual acuity was noted, Schummer's test and tear film breakup time was tested, slit lamp examination and fundus examination was done. Periodic follow-up of these patients was done till 90 days of the therapy. So the statistical data that was collected was tabulated in Microsoft Excel worksheet, and these categorical variables were then summarized as proportions and percentages. The table 1 shows all the acute side effects found in the study population, of which dry eye consisted the highest amount, accounting for 20% of the study population, followed by mydriasis 7.05%, erythema 5.89%, pigmentation and meibomitis 3.53% each, and lastly dermatitis and conjunctivitis 1.18% in each category. No case of radiation retinopathy was found till 3 months of follow-up. This is a graphical representation of the complications found in the study. And coming to the discussion, Lana et al. In 2004 reported that 76.5% of the patients receiving radiotherapy for tumors of head and neck experienced acute ocular side effects, which is high compared to that of ours, which is 42.05%. In 2012, Bhandare et al. Mentioned in their study article that incidence of dry eye syndrome increased steadily from 6% at 35 to 39.99 grays to 50% at 45 to 49.99 grays. In our study, radiation dose ranges from 40 to 60 grays. In a study by S. Maharia et al. In 2019, dry eye was found in 33% cases as acute side effect of radiotherapy for head and neck tumors, whereas in our study, dry eye accounts for 20% of the cases. Nuzi et al. Described an overall incidence of 16% of cases of eyelid complications in their study. Jagannathan et al. Showed the onset of mydriasis only for doses greater than 50 grays. In our study, as mentioned earlier, the radiation dose ranges from 40 to 60 grays. Mettler and Upton mentioned that the initial skin reaction is seen within 2 weeks of fractionated external beam radiation therapy. A study done by D. Chen et al. In 2018 showed diffuse meibomian gland loss in both the eyelids of the diseased eye 12 months after the onset of radiotherapy. In our study, 42.05% of the patients underwent radiation treatment for head and neck cancer, and these patients presented with acute ocular complications which include dry eye, followed by mydriasis, erythema, pigmentation, meibomitis, and dermatitis and conjunctivitis. Acute ocular complications in patients radiated for head and neck cancer is unavoidable, but these complications can be minimized or delayed using modern radiation techniques and with proper protective measures. Thorough clinical examination leads to early detection of these adverse effects so that timely and specific treatment will restore vision, thus preserving the normal ocular function. Lastly, I would like to conclude my study with the photographs of this patient found during the study period. So figure 6 shows mydriasis in a patient with basal cell carcinoma after radiotherapy. Figure 7 shows conjunctivitis in a patient with sebaceous carcinoma during the process of radiotherapy. Figure 8, dermatitis in a patient of adenocystic carcinoma of lacrimal gland post-radiotherapy. And lastly, figure 9 shows pigmentation in a patient of maxillary carcinoma post-radiotherapy. These are my references, and thank you for